Hi, I'm Sarah Hopper, an occupational therapy assistant student with the American Stroke Foundation. Today, I want to talk to you about memory issues you may experience after a stroke and what adaptations you may be able to use to help with this. First, I want to create a foundation by talking about the different types of memory. Long-term memory are those long conscious or unconscious memories. They could be conscious memories, like what presents you got for Christmas as a child, or they could be unconscious, like how to ride a bike or how to get dressed. Short-term memory are those memories that you use during the day. It's remembering what you needed at the grocery store and those things that you're only holding in your mind for maybe a day. Working memory is even shorter than that. It's when somebody calls you and they tell you their phone number and you write it down. It's enough memory to take it from when they told you to writing it down on the paper, but then it doesn't stay in your brain after that. And then attention is also important. It isn't a type of memory, but if you are not able to pay attention to what is being said, you're not going to be able to remember it. A couple other important things to know about memory is that it's stored in different parts of the brain. Our long-term memories are stored deep in the brain, but our language memories are stored more on the left side of our brain, and our vision memories, for example, are stored more in the back of our brain. So when we are bringing a memory forward that has both language and vision in it, we're taking the pieces from those parts of the brain and putting them together like a puzzle. Now, the more often we do this with a specific memory, the easier it is to remember. That's how we get memories like how to get dressed or how to brush your teeth, because we are accessing them every day. That pathway is getting easier and easier to use. Now that we have an idea of the different types of memory and how they're pulled together in our brain, we can talk about what memory slips you may experience with normal aging or after a stroke or when you may be developing vascular dementia. With normal aging, we're going to have several memory slips here and there. We're going to forget the word sometimes. We're going to misplace a commonly used item. Have you ever been looking for your glasses just to realize that they're on top of your head? You may also miss a deadline or a bill on occasion, or you might forget which day of the week it is or what's scheduled for that day. These are completely normal memory slips and are nothing to be concerned about. After a stroke, you're probably going to experience even more memory slips. What you experience will vary depending on where your stroke occurred in your brain, but you might experience confusion or difficulties with that short-term memory, like knowing what to get at the grocery store. You may wander or not recognize your surroundings like you used to. Maybe you go to a park that you're very familiar with, but then it doesn't look like you remember it looking. You might struggle with conversations. Now, this is different than aphasia. This is when you're struggling to remember what they said or struggling to remember what you want to say. This is not knowing what you want to say, but having trouble getting the words out. You may also have difficulty following instructions because you have to remember a lot of different steps all at once to follow instructions for a baking recipe. A couple other things to consider about stroke is that the side effects you experience can be worsened by medications, stress, depression, lack of sleep, or poor nutrition. Many of you know that when you're extra stressed or you lack some sleep, you're not functioning as best as you can. Your body physically doesn't feel good, but your brain is also going to have trouble accessing those memories that you're trying to use. And with stroke, it may improve over time, but often strokes leave lasting effects, so you're going to notice years down the line still having some deficits. But that does not mean that you cannot improve. and that you can't keep working at getting better. Vascular dementia is a type of dementia that occurs in about 30% of people who have experienced ischemic strokes. Vascular dementia worsens over time because damage in the brain is continuing to accumulate. It is more likely to develop after repeated strokes or with multiple risk factors like smoking, high blood pressure, high blood sugar, or family history. Dementia will have a larger effect on daily function, especially as it continues to progress. You may notice yourself having more and more trouble with your daily tasks. Dementia can also impact reasoning, judgment, motor skills, and vision, which can make it hard to determine what you're experiencing that is a side effect of your stroke and what you're experiencing that may be from dementia that has developed. Other factors that are important to consider is that this isn't cut and dry. There is no clear sign that a memory slip you experienced is dementia versus typical aging or side effects of stroke. If you are concerned, it is best to consult your doctor. It's also important to lower controllable risk factors. Many of you already know risk factors that are associated with having a second stroke. These risk factors are very similar to risk factors for developing dementia. So lowering these risk factors can prevent or help slow the progression of vascular dementia. And then side effects of stroke often improve slowly over time as the brain creates new pathways. Dementia, because the brain is experiencing more damage, will continue to get worse over time. Now we'll discuss what practical problems you may experience because of memory slips and potential adaptations that you may be able to use to help you in your daily life. When you are experiencing problems with your memory, there are a couple different issues that may be occurring. You may be having trouble retrieving old memories that are already in your brain, or you may be having trouble storing new memories. This can be from a variety of factors. Like I talked about, stress can cause issues with storing these new memories. The other thing that may be an issue is executive functioning. Executive functioning is kind of like a little manager in your brain. It helps with organizing, prioritizing, problem solving, and with emotional control. If you're not able to organize the memories in your brain, or if you're not able to prioritize how you store those memories, it's going to be difficult to retrieve them later. Now, difficulty with storing new memories, you may have attention deficits, and this could just be that a loud TV is on next to you, or it could be that the pain you have from other stroke side effects is distracting you from hearing what someone is saying. You may also just not understand what they're saying. If you're at a doctor's office and they're using all this medical terminology, it's a lot less likely that you're going to remember what they said. So it's okay to stop them and tell them to re-explain in some more normal terms. Some potential adaptations you might be able to use is organization. What I mean by organization is keeping items you use in the same place every day. I don't mean to completely reorganize your house, because that change is going to make it harder to remember where items are stored. But keeping the items you use most in designated spots is going to make it easier to remember where they are. Note-taking is also a great strategy. Having a notebook that has a calendar and blank pages to write down any appointments you have, grocery lists, questions for your doctor, anything that you find important. And with this notebook, You should have one designated spot to keep it so you know where to look for it. Next is repetition. You can say something out loud to yourself, and that helps cement the memory in your brain. And then also relaxation. Like I've mentioned, stress can make it harder to remember. So taking a few deep breaths and calming yourself down may make it easier to retrieve that memory you're having trouble with. Pictures are also great. If you're having trouble remembering to take your keys when you leave your house, you can have a picture of keys by the front door that you can use. You can also take a picture of items if you're away from your normal environment. You can take a picture of your keys when you're at someone's house to remember where you put them. The next thing I want to say is involve more senses to help you remember. Being able to see and hear something makes you more likely to remember it than just seeing it. That's why sometimes reading along when someone is talking to you can make it easier to remember what they said. Lastly, and this is very important, is avoid overload. You don't want to have too much information going into your brain all at once, or it's not going to be able to remember it all. For example, if you schedule your doctor's appointment and physical therapy and grocery shopping on the same day, and then you go out to dinner with some friends, you're going to have trouble remembering everything. That little manager I talked about in your brain needs time to process the memories and to help you store them for later. So, spreading appointments out and giving time in between them for you to rest is going to make it more likely that you remember what happened at each appointment. Next, we'll talk about if you're able to work out your memory and improve it over time. So, with working out your memory, I want to say that memory engagement and mental engagement is always a good thing. There isn't a lot of research for the direct impact of practicing your memory and how that impacts your long and short-term memory. But there is research that doing mental workouts can help other things in your brain, and it can help like your executive functioning, that little manager in your brain, and that can help your memory indirectly. So neuroplasticity is kind of like road work in your brain. Your brain is constantly changing, and especially after a stroke, when there's a place of damage, your brain is trying to create new pathways around that damage. So you can imagine how road work is always occurring when you're driving around. It's the same in your brain. Your brain is always repairing roads and making new ones. The other thing I want to mention is that physical workouts have been shown to improve mental function after stroke. So you don't just need to do the mental workouts, but physical workouts in tandem with that will help your recovery even more. Some potential exercises to work out your brain are card games. You could do this alone by playing solitaire, or you could play whatever game your family likes to play together. Applications on your phone or your iPad can have puzzles on them. There can be card games or word games that you can play on your phone. Budgeting and counting change is a great way to practice that short-term memory and that working memory. Word games like crossword puzzles can help that long-term memory and that problem solving. Same with Sudoku. Sudoku can work that problem solving while also being a little relaxing. Speaking of relaxing, reading is a great way to relax, but still practice that mental engagement. And lastly, the American Stroke Foundation has other videos that have trivia or physical workouts that you can use to keep your brain active. The last thing I want to say is that consistency is key. Whether you're trying to implement some of the adaptations that I gave you, or you're trying to work out your brain mentally and physically, the most important thing is that you're consistent. You don't need to constantly be working out your brain, but if you can schedule consistent times to do it, that will give you the most benefit. Thank you for listening to my video, and I hope there are a few things you are able to take away from it. These are the references that I used in making this presentation.